Good morning, Mary. How are you doing today?
Hi, I'm doing all right. How are you?
So I'm assuming you got my email, and this is why we're
Yeah, I
meeting.
got I got your email back. Thank you for answering. That was really nice.
Okay. I'm glad to have you here. I do have a couple settings that we can put you in. I have some outpatient clinics, acute rehab. We have inpatient. Um, we have some pediatric, uh, SNF facilities. What were you thinking you'd like to go into?
Anything. Right now, my professors are having difficulty placing me,
Mm.
so I just want to get some clinical experience for my field work, and I really want to graduate on time. So I felt like it was not fair for me to not have a fieldwork site for my fieldwork too. Um, so that's why I contacted you because I knew that you had some placements.
Yeah. So I am prepared. I can have you here, let's say in next week, starting Monday. You can come in at 9 o'clock and we can get you set up in a SNF facility. And
Yeah, that would be nice. I'll take anything you have.
yeah, and then we'll do a lot of the telehealth part sessions. Does that sound good?
Yes, thank you so much for the opportunity. I really appreciate
You're welcome. Um, is there any other questions you have for me?
it. No, I'll email you for any question that I may have in the next week so that I can be ready for next week.
Okay, and just to remind you, if you could just brush up on some of the anatomy and some of the other like the muscle movements and stuff, like extension flexion, just so you could have a good memory of those when you start Monday, okay?
Yeah. One question before I leave. Would I need to have like a specific uniform or any paperwork that you might need?
So when we get there, we'll have you fill out a HIPAA violation, or not a HIPAA paper. That just goes to show you know what HIPAA is and you know that what it can do to your license and mine. Um, and then we want you in navy scrubs and non-slip shoes.
Okay.
Okay.
All
Oh,
right.
and of course hair tied back and all that. So, okay.
All right. Thank you so much.
You're welcome.
Bye.
Bye. Good morning.
Hi, Caitlin. Good morning. So, I called you to this meeting because something has been brought to my attention, and I thought you needed to know before I make any decision going forward. I heard that you are taking up a student for fieldwork, which was not brought to my attention. That decision didn't go through me. You just decided. Is there what's going on?
Well, this she's a friend of mine and she's having a difficulty finding a fieldwork site. So I felt it was in her best interest if I took her on as a student. I feel pretty competent in my area and I feel like I could help her a lot. I know I've only been practicing for 3 months, but I feel like she's a really good friend of mine, so that's why I took her on.
I do understand your perspective on you taking your student on, but also you do realize that there are rules set in place, and where as OTs, as people in this profession, we're supposed to follow those rules, regardless of the relationship we do have for people. I understand that you sympathize with her, and that's why you want to take her in. But at the end of the day, you've only been practicing for 3 months. You're still an entry level yourself, and you have people watching over what you do, not in a bad way, but so you can get enough practice yourself. But taking on a student right now is not ideal in the situation. Uh, we do have people who take those charge. Like when you've been here for a year, there's somebody that like overrules that the whole board of like taking students for field work. We do have people in place who do that. We just don't let coders themselves reach out to student and take student without having like spoken to the supervisor or the fieldwork coordinator themselves. And also, like I said, you've only been practicing for 3 months, and for you to be able to coordinate anybody or supervise anybody, you're supposed to be practicing for a year.
Okay.
So if you're taking that role up yourself, aside from you like not even following the rules, you're also putting like a lot of stress on yourself because you're just getting to know the rules and guidelines of this facility yourself. Do you understand what I'm saying?
Yes, I understand that. I
So
understand.
like for next time, if you, even if you have like a student, somebody reached out to you, you might want to speak to the supervisor, me or somebody else, like an OTR or somebody else guiding that department first before agreeing to uh, take up the student, because now you just gave her a reassurance that you're going to be taking her, which is not going to be happening. Not to like mess y'all's relationship up or anything, but we do have to follow the facility guidelines. So now you have to reach out back to her.
Okay.
And for next time, she should not even be reaching out to you as a coder yourself. It should be a school reaching out to you, because that's also breaking the guideline. Because y'all already close. If you're taking it up, there she might do something and you don't want to correct her because she's like a friend to you.
Right, I can understand that. So should I get back on the phone with her or have another meeting with her and tell her what the situation is? Or is
You
that something you will have to do?
I'm gonna reach out to her just so it doesn't like there's no any like a backslash or anything. I'm gonna reach out to her and let her know.
Okay.
I'm pretty sure the school does have like a system that gets to our site to know if we want to take student and have them supervised by somebody who's been practicing for a while.
Okay. And as
'Cause
far as is there anything that I have like do I get written up for this or is there what is
no, that's why we're having this meeting, because
okay.
I'm pretty sure you didn't have an idea. That's why you went forward with it. So
Yeah,
you're not gonna
I
get
didn't know
written up.
that.
Yeah,
You
you're not gonna get written up for this. We're just to let you know, and next time you talk to somebody in the department and not
okay.
just take the student without you letting us know. Sounds good?
Yes.
And I hope you have to enjoy the rest of your day.
Thank you. Bye.
Bye. Hi, Caitlin.
Good morning.
Morning. So we talked about what happened between you and the lady that you spoke to about taking her for field work.
Mhm.
I reached out to her yesterday and we spoke over the email. I explained the situation of what's going on right now and the development with taking student who you taking her for field work.
Mhm.
So the school's gonna reach out to me and we're gonna decide on what happens thereafter. Before you, I really want you to like understand why it's important that we're not taking student you're not taking student when uh you're not at the point to have that student taking you can't supervise the student yet because you've just been in practice for 3 months, like I said. So
Right.
to make sure that you do understand, I'm gonna give you like an homework.
Okay.
I want you to go in the A code standard and find the standards, that the ethics that kind of guide are like you being able to supervise a student, where you're supposed to be, how many years of experience you should have before supervising somebody. I want you to go ahead and look that up. I'm gonna give you the weekend. I'll be expecting to have that back by Monday.
Okay.
I also want you to go through the guidelines for our site here. Get yourself familiarized with the department, the fieldwork coordinator. I want you to go ahead and try and find that those information as well, and I'll be expecting to get those on Monday as well. Does that
Okay.
sound good?
Yes. Do you want that? an email, or do you want me to write it on paper, or how do you want me to get that to you?
I wanted an email, but we can also, after you send it to me, we can go back on the call and you can explain to me so I have an understanding that you
Okay.
kind of get a grasp of what you sent me.
Okay, so you want to just have like a quick discussion about it. Okay, I
Yeah,
can do that
sounds
for
good.
sure. Yeah, thank you.
Good. All right. Hi, everyone.
Hello.
Hello.
I'm gonna let Mary. You're gonna go ahead and introduce yourself.
Hi, Sammy. How are you doing? Hello, Caitlin.
Hi.
Hello.
I'm Mary. I'm the director of the supervising department for students and coordinators. I'm the one that's responsible for directing that everything's according to the standards for each of the professions here. So I supervise OT and PT and also speech therapy departments to make sure that there's quotas and PTAs and everybody that's entry level know how to get ready for field work because I heard that you were interested and that there was a little bit of a hiccup there. So I'm just here to see to make sure that everything is fine and that we understand all the rules. So I'm just going to be listening and make sure everything is good.
Okay.
Okay.
Thank you for that. Caitlin, before we go on with this meeting, that's why I have Miss Mary here today. I'm gonna go ahead. The assignments that I gave you the last time we spoke, do you have the answers to those?
Yes.
Okay.
So I found in the ACOTE standards C1 11 that a qualified fieldwork supervisor must have a minimum of 1 year full-time experience or equivalent um, of practice that is licensed or otherwise regulated by an occupational therapist or a CODA. And then document and verify that the student is supervised by a currently licensed or otherwise regulated occupational therapist or occupational therapist assistant.
Okay, that's good. So you do see what I was telling you about the last time we spoke. I do see that you're really passionate about supervising a student, which I think is really good. But I do, since you're really looking forward to do this at some point, I
Mm-hmm.
would think you should get started right now. Start preparing. Uh, I can get you prepared to help you work towards that goal in a year. So you're able to take a student. And Miss Mary's also here as well. She has all of the ideas about that. And you're helping with patient, you're getting the extra knowledge you need so you can supervise somebody next year. So the
Okay.
whole plan, now that you have an idea of what we're talking about, the whole plan is to get you prepared because we see that you're really passionate about supervising the student next year. Miss Mary is going to go over some of the things, ideas that she has as well that can
Okay.
help you get prepared for next year.
Okay, so thank you, Sammy. You kind of summed it up a little bit. I wanted to ask you, Caitlin. Um, I just wanted to know, why do you think this 1 year requirement is important? It's just so we really understand.
So I think it's important now that I know about it that I understand the actual role of what it is and what it means on to take on a student. I guess I found out that it's kind of going to add a lot more stress to my situation because I just got here and I've only been here for 3 months. And then I think it would be really good if I kind of learn how to give that feedback and make sure it's a constructive criticism and know how to do that and even in myself know how to take something if say the student doesn't really agree with something that I'm doing and maybe the student wants to give me feedback. So maybe give constructive feedback and receive constructive feedback. Um, so I think those are some good things that I need to work on this year is knowing how to do all that.
Okay. And can you tell me one more thing of why you think? So why is the requirement 1 year and not 6 month or 2 year or 3 year? What do you think 1 year?
I think 1 year means that I'm gonna be more competent in my setting. I will know and would know a lot more than what I do now, and I think it would benefit the student much better if I was had that experience.
Yes. And it's also to allow you to take on students a little bit earlier because 2 years becomes a little bit long. But
Okay.
1 year I think is very reasonable. So, and since you wanted to get a student, I know it was your best friend, but were you interested in taking some students in the future?
I am. I would like to take on a fieldwork student once I meet the requirements. Um, so I had no idea that was in place.
Yeah.
Sorry for all
So
that.
it's yeah, so it's good that now you know. Because we want to avoid reprimanding so harsh if it's
Mhm.
a little mistake. The student is the one punished in there, but we have arranged something for that student with the actual coordinator for that school.
Okay.
Because they're not supposed to go through uh quotas directly working facilities. They have to go through their professors, and actually the professors are the one deciding the field work for them because they're matching them personality wise and also strength wise. So that's another consideration where we cannot just go and take a student randomly because maybe they are not good enough to be in that setting, or maybe their strength lies somewhere else. Maybe they're better with pediatric
Right.
clients than orthopedic clients. So that's another reason why we let the professor decide the field work. Um, and I think one more question I may have for you would be, how do you think you can get prepared for field work, supervising, other than feedback, like how to learn and take feedback? But how can you get ready? Do you remember your own field work rotations?
Um, I remember pretty vaguely. It's been quite a stressful situation getting to this point, so kind of remember vaguely, but I'm sorry, can you repeat your question again?
So I'll rephrase for you. So based on your own experience of field work too, when you were a student, what do you think the supervisor had to do in order to be ready to take you on as a student? So now that you would be a supervisor, what do you think you need to do to take on students by yourself?
So, of course, needing that 1 year experience, getting that 1 year experience and learning how to give and receive that feedback. And yeah, is there anything you want to add? Then let me know.
Yes, I would like to just pinpoint a couple. I took some notes. They are right here. Let me just read that to you real quick.
Okay.
Okay. So, I want you to understand that taking on students is it's very difficult by yourself because not only it's a volunteering thing that you do it for CEUs or not. Some CI just really love to take on students and um show their knowledge and share it. But you do have to go through taking your feedback, like you said, but you also have to create schedules. You have to be sure that you supervise the student as according to the standards. So there's supervising levels. You also have to have the mental capacity for it because you can't just go in with the patients or your clients. You also have to supervise them doing treatments. You have what they do, you are responsible for, and by then your OT is also responsible for this. So basically, when you take on a student, you're responsible for them, but your OT is responsible for you and them. So they have to really be supervised, and
Hmm.
you also have to do your time management. You have not only yourself to kind of manage with time, but you also have to manage your student when they're there too. So if
Right.
they are late, it makes you late as well. And then there's other things like how many student you want to take, because normally supervisor will take on one student, two student, but some supervisor can take on up to maybe 5 or 6 students, maybe more. We never know. It depends on what you want to do. So we want you to really think about this. And how would you evaluate those students? How do you know if they're going to do these things well? Or how do you, like, you will be responsible for them passing or failing that rotations. So you really need to think about that too.
Okay.
So those are all just points that are important to consider before you take on that responsibility.
Well, thank you for letting me know that.
Yeah, it's a lot to take on. We just
It
want to make sure
really
if
is.
you're interested, but that's why 3 months may be a little bit too low of a time for you.
Yeah, I think, and I think after that, I get to my 1 year mark. I'd be ready to take on that student. So,
All right.
okay.
I'm glad this meeting was really helpful to you, Kitlene, and I hope like going forward, you're asking people and like talking to people around you so you have an idea before making decision. This was a one-time mistake, and going forward, we're trying to be. We don't know everything. We're all trying to be better at what we do. But it was
Mhm.
all nice having your ladies in here. Thank you so much, and I hope to see y'all next time.
Okay. Bye. It's nice meeting you,
Okay.
Mary.
Yeah, have a great day.
You too. Bye.
Hey, Sammy, how you doing?
Good. Just doing some notes here.
Yeah, I see that you've been sitting there for like 2 hours now. Where's your OT?
I think she's on lunch. She got called for something. I'm not sure, but I'm just here, like making notes. There's not much to do, to be honest.
Oh, okay. Well, I'm a coda and I have a patient in about 20 minutes. Would you like to come and check out the session with me? I mean, I know you're not supposed to and you're supposed to follow your own OT, but I can always take you on for like the next session.
Of course, I would love to. Like, I'm not doing anything here. It'd be nice to do something. Yeah, of course.
All right, well, just kind of keep it secret. I know she's on lunch and normally she takes lunch until this time. If you say that that's what she wants to do, then she's gone for lunch, then just come with me, no worries.
Yeah, of course.
All right, just keep it secret, just follow me, and then when you're done with the treatment, just take your note and come back here.
Alrighty.
All right.
Hi, Miss Caitlin.
Hello, Sammy. How are you doing today?
I'm good. I reached out to you because I work on the neuro floor, and
Mhm.
I had observed today. I don't know if it's out of yours, like code or anything. Just wanted you to know. So
Okay.
I had seen a coder today reaching out to take a student, and I remember that she's just been working here for a few months, and I
Mhm.
did hear that she's also a new hire, and she just started working in the OT field like for about 3 months. So, and she was taking a student, and it wasn't her student. She just volunteered to take her, and she kept telling her not to tell anyone. And I like want you to know to be sure that everything is under control because I'm not sure what's going on there.
Okay. Was this when I was on my lunch break?
Yeah,
Do you see
it was
this?
on.
Okay.
Yes, you were on your lunch break.
Okay. Well, thank you for bringing this to my attention. I will address this in my department. We will need to have a short meeting with you and Mary. Her name is Mary, is the CODA. And we'll kind of bring her in and let her know that this is not acceptable. So if you could just take some time out of your day this afternoon, we're going to have a short meeting. Is that okay?
Yeah, that's fine.
Okay.
Alrighty. Thank
Well,
you.
again, thank you for bringing this to my attention, and I'll see you in a couple hours.
You're welcome. No problem at all.
Bye. Good morning, guys. How are y'all doing?
Good morning.
Okay.
Hi, doing okay.
Hi, Mary. So, we have Sammy over here. I'm going to let her introduce herself to you and kind of tell you what's been going on a little bit.
Hi guys, my name is Sammy, and I'm a tech on the mirror floor. I'm there all day, every day because that's most of the floor that I'm like placed at. And I did observe something yesterday, which I brought to your supervisor's attention. You were volunteering to take a supervisor student yesterday, and I know that you just started working it a few months ago, and I wasn't sure, but just to make sure everything is going okay, because I know at the end of the day, our patient's goal is to like most focus here. So I needed to make sure. So I reached out to your supervisor uh, to be sure that you're like you can take up that role, and that's why we're here right now.
Thank you, Sammy, for letting her know what you saw today. Mary, I just want to know that this is not acceptable. We have rules in place in order for a CODA to take on a student. Um, there are several requirements. You have to have 1 years of experience, and you also, within that experience, you need to learn how to competently and take on the student and be competent and making sure you know that this role is a lot of work. So what I want you to do is, if you could go to the ACOTE standard, the website on AOTA, and there are some standards in place, and I would like for you to read those standards and send them to me in an email so I know that you have reviewed them, and then we can kind of discuss further after that, okay?
Yeah.
This won't result in any write-up or anything. I understand that you seem very interested in trying to take on a student, and that makes me happy. Let's get you to this year experience because you've only been here for a couple of months, and then we'll work on getting you a fieldwork student so you can be that supervisor. Okay.
Yeah.
Okay. So thank you, Sammy, for bringing this to our attention. And Mary, like I said, let's get that email to me so I know that you have read that. Okay.
Yes. By when do you want this so that I know that
Let's get it to me by tomorrow afternoon if that's possible for you. Okay.
yes.
Alrighty.
All right.
Well, thank you,
Mm.
ladies. Have a good evening.
Thank
Thank
you.
you.
Bye.
Bye.
Bye.